Order and a very warm welcome to this final evidence session for the Pathways to Work inquiry, and it's a pleasure to welcome the Right Honourable Sir Stephen Timms, a Minister for Social Security and Disability, and his colleagues Catherine Pateman and Sean Butcher. I don't know if you'd like to introduce yourself, Catherine and Sean.
Hello, I'm Catherine Pateman. I'm Deputy Director in Policy Group at Department for Work and Pensions for Disability Benefits.
And I'm Sean Butcher. I'm Deputy Director, Lead Analyst covering disability benefits in DWP.
Thank you so much. I'm going to kick off if that's all right. And Stephen, we're going to, or Minister, we're going to continue from our exchange at DWP Orals on Monday. And I asked you, if you recall, in terms of the anticipated health impacts of pathways to work, and particularly thinking about the health impacts. The last time you were here, we were looking at and taking evidence from you around the safeguarding vulnerable claimants. So you'll be aware of the recommendations from that report, specifically about making sure that we consider the health impacts of the policies that you develop, a safeguarding approach around that. We talked about the role of the Chief Medical Advisor's team in being able to assess that. So I don't know if you're able to talk further on what you have assessed as the impacts of the Pathways to Work inquiry, specifically in relationship to the bill that's coming to the House on Tuesday.
Well, thank you, Chair, very much for the opportunity to come before the committee. The background to all of this is the position which I think is pretty clear, that the current system does not work. As you know, uniquely in the G7, our employment rate is still less than it was just before the pandemic. Every other country has got back to where they were before. We haven't, and I think it's clear that the system here is a big part of the reason for that. And that a very large number, hundreds of thousands of people, are being trapped needlessly out of work, in low income and inactivity, because of what the system is doing. And we are determined to fix that and make sure that people do have the opportunity of employment, a large number of people not having that at the moment. Now, we will be responding fully to the department's, to the committee's inquiry on safeguarding. Thank you very much to everybody for the work that went into that. We are also in the Green Paper consulting on our safeguarding approach. And so I'm not able yet, I can certainly talk about it if you'd like me to, where we might be heading with that, but the consultation runs until Monday, it isn't closed, so we will take a bit of time to reflect on the consultation responses before we finalise our proposals for safeguarding. But the committee's input to that has been extremely helpful. In terms of the health impacts of the Green Paper proposals, I think they're going to be positive, because I think it's clear that a lot of people have an adverse effect of being out of work for a long time when that isn't needed. And there was a figure which I saw the other day suggesting that of those who are out of work on ill health and disability grounds, 86% report a mental health impairment. Not necessarily their primary impairment, but it's a big factor for them. And we know that being in good work is extremely positive for mental health. So, we're going to need to take these proposals forward, recognising the health gains that will result, but also safeguarding those who may be at risk. And our new strategy on safeguarding will be well in place, I think, in time for the changes that we're proposing.
So, Can I just take you back to the examples that I mentioned on Monday? So Monday was I referred to the 2010 changes in employment support allowance, which was an incapacity benefit. So you'll remember that I raised the figure of there was an additional 600 suicides because there hadn't been in place at the time the jobs that you have, and I know there's a lot of really positive things about the Pathways to Work programme, Charlie Mayfield's review to try and ensure that we do something to address the appalling disability employment gap, which has remained more or less flatlined for 10 plus years. We know in terms of the right to work, lots of positive things, but as it stands, these aren't in place. And you may have seen the JRF paper yesterday that was produced that shows there just basically aren't the jobs for disabled people to go into, particularly in deprived areas. So thinking then specifically, and I also think that overall that there will be lots of positive outcomes, but as they are sequenced and as the committee has been looking at specifically around the cuts in support to disabled people before these jobs are there, before the employment support is set up, as from next April, will be adverse. As I say, 600 additional suicides during the reforms for 2010, 130,000 additional new onset mental health cases. Without that, for the 2017 changes to work-related activity component, what are we going to do to make sure that we can line these up so labour market's fixed and people have jobs to go to, the employment support is in place to enable this to happen, opportunities for people to avail themselves of?
Well, I think that sequencing point is a very important one. So, as you say, the changes we're proposing will start from next April on universal credit.
As in the cuts to individuals?
Yes, I don't think anyone will see a cut next April. I think new claimants from April will have a lower rate of universal credit health premium, but nobody will experience a cut in that sense in April. In November, the changes to personal independence payment will start, and there will be some people up from November onwards who have been receiving personal independence payment who won't receive it. As you know, our expectation is that about 90% of those who are claiming personal independence payment next November will still be having it by 2029-30. That's based on the Office for Budget Responsibility Assessment. So, the change to the individual will only happen at their next award review after November 2026. So this will build up over some time. Typically it's 2 or 3, particularly 3 years between award review. So the 3 years after November 2026 will be the key years for that. And you're right, we need to make sure that employment support is in place in time for that health and care support is there for that, and also that the very important announcements made at the spending review about investment in infrastructure and jobs, particularly in some of the more disadvantaged areas, that those are coming into place by then as well. And I think that is what we're proposing on all of those fronts, that we will be seeing the progress that we need. I mean, we do have to do all of these things in parallel. I don't think it's sort of would be a viable option to say, well, we're kind of not going to do anything about the health and disability benefits for a few years and see how things go. I think we've got to make all of these things happen, and as you say, sequencing is key.
Thank you. Do you explain why there wasn't a consultation on the provisions within the bill?
Well, essentially because of the urgency of the changes needing to be made. So, look at personal independence payment. The year before the pandemic, in current prices, PIP cost the then government £12 billion. Last year it cost the government £22 billion, and the cost of it went up by £3 billion per year, or 2.8 billion per year last year alone. And that is not a sustainable trajectory. So there was a need for urgency with the changes.
Okay. Minister, do you accept, as we had evidence from, for example, Professor Ben Geiger, that in terms of working age support, spending has remained at 5% GDP for the last 10 plus years? I appreciate that we've that has, in terms of disability benefits as a whole, that has increased, but then we also know that from people who aren't in work, or non-disabled people, that has actually gone down. But overall, it's been 5% of GDP for the last 10 plus years, and that's the important figure to relate to. Do you also accept that DWP's own papers have shown the increase in, for example, PIP cases has been as a result of demographic changes, our poor health, also the increase in state pension age?
Well, yeah, I mean, much of what you say I completely accept. Indeed, the Resolution Foundation has set this out all quite helpfully, I think, that working age social security spending as a percentage of GDP isn't much more now than it was before the 2008-2010 recession. But as you say, the share on disability and incapacity benefits is very substantially up. That was 1.1% of GDP in 2007-8. It's 1.8% in 2024-25, and almost all of that increase is in the last 6 years. And I think it's clear that does require the government to address, and that's what we are doing. Sorry, the second part of your question about PIP numbers. Yes. Well, I mean, the evidence is, the survey evidence suggests that the incidence of disability has gone up by about 17% since just before the pandemic. The incidence of benefit claiming, if you like, has gone up by 34%. So it's clear that it's not just the factors that you've referred to that are driving this. That's certainly part of it. But that there has been a much greater propensity to claim benefits, and that's what's driving that very, very steep increase in the GDP share accounted for by health and disability benefits.
Would an alternative explanation be that the people that are claiming are financially constrained, and as you and I know, in terms of PIP, is around extra costs? But
yes, let me respond to that. I think you're absolutely right. I'm sure that the cost of living challenges are a very big factor in what's happened, that people who may well have always been eligible but have not in the past claimed benefit are now doing, and that's what's driven this very substantial increase. And as I say, the current trajectory is not a sustainable one, and it's not in the interests of people who depend on PIP for it to be on a financially unsustainable trajectory. We do need to deal with that.
Peter Bedford.
Thank you, Chair. Minister, if I may just touch on the elephant in the room. You've got your second reading of the welfare bill due to come before Parliament on Tuesday. Is it still your intention to bring that bill forward for second reading on Tuesday?
It is. I'm looking forward to the debate.
Thank you very much. On to questions for today. So over the last number of years, particularly in recent years, there's been an increase in working age health-related benefits. It's increased quite substantially, whilst working age non-health related benefits has dropped off. And there's a suggestion, I think you touched on in your answer to the Chair a moment ago, that this is as a result of people claiming because of cost of living pressures, all those things we've seen COVID over the last number of years. I just wondered how that's been factored into your decision making, particularly since the freeze in the standard rate or standard allowance since 2015.
Well, as I was explaining, the fact that the costs of health and disability benefits have risen so sharply, especially over the last 6 years, that's been a big factor in our thinking and driven the need for these changes. And I think part of the problem has been the very low value of the universal credit standard allowance, that as a result of the freezes and things that you referred to, the headline rate of benefit fell to the lowest real terms value, I think, for 40 years. So, you've got to go back to, it was Margaret Thatcher who lifted it above the level that it's been at of late. And the previous government reduced it back down to that very low level. And I think all sorts of problems have arisen from that. And one of them has been a very big incentive for people to claim the LCWRA, the Universal Credit Health Top-Up, because of the huge gulf now between the Universal Credit Standard Allowance and the health top-up rate. So we've announced, as you know, and the bill that you referred to being debated on Tuesday includes I think the first real terms increase in the headline rate of benefit since the 1970s. It is quite a dramatic change of course in public policy that we're saying that the headline rate of benefit was too low. That's partly what's driven these problems that we're talking about this morning. And an important step in fixing this problem is to raise the Universal Credit Standard Allowance rate as we are doing. I think another problem arising from the historically low level of the standard allowance rate, and this is a point that was made in evidence to this committee, and Chair, you might remember this, by the think tank Bright Blue, who made the point to us that the headline rate was so low that people have been forced to rush into the first job they can come across, even if it's not the right job. And Bright Blue argues that's contributed to the UK's long-standing productivity problems, because people are being forced into the wrong jobs by the very low rate of the Universal Credit Standard Allowance. So, yeah, fixing that, raising it, is an important part of dealing with the problems that we're focusing on this morning.
I think some colleagues have got some questions later on getting people into the right jobs. Just going back to health, though, particularly mental health over recent years. We've had the pandemic, we've had a lot of upheaval in the country over recent years, and there's been a marked increase in those with mental health problems claiming these types of benefits and support. I just wonder what your view was on that, in terms of, has mental health got worse in the country at that time? Is it an issue of diagnosis? Is it that people are more willing to use mental health now as a reason for claiming this benefit? I just wondered what your views were on that. Yeah,
I think there's fairly clear evidence that there has been a worsening of mental health since the pandemic, particularly amongst young people. That's where the evidence is most striking. And certainly, if you look at what's driving the increase in the PIP caseload that we've talked about, then mental health problems are a large and growing part of the picture. And yet we know, particularly for young people, that the most positive thing that can happen to support good mental health is being able to move into good work. And so that's an important part of the motivation for what we're doing, to make sure that young people do get that chance. We've got the youth guarantee that we announced in the Get Britain Working white paper in November. We want every young person to be learning or earning. So there has been a big rise, particularly in mental health problems amongst young people, and this package is designed in part to deal with that and help people move on from the difficulties that they've got into around the pandemic, and perhaps in particular.
If I may come back later on the issue of getting people back into work. But thank you. Thank you.
Anna Baxter.
Thank you, Minister, for joining us this morning. Moving to personal independence payments, the PIP provisions in the bill that was published last week provide for a 13-week transitional protection period for those who lose their entitlement at their next award review as a result of not scoring 4 points in at least one activity. Do you think that transitional period will allay the concerns of those people who are affected by that?
I think it'll certainly help, because what we will do, and obviously we've been listening to what everybody's been saying about these proposals over the last few months, what the 13-week run-on will allow is for us to deliver the support that we referred to in the Green Paper, the employment support, personalised employment support, and also the support to make sure that people's health and care needs are met. And we'll be able to deliver both of those in that 13-week run-on period before benefit ends. So that'll certainly will certainly help. It's kind of historically a very long run-on if you compare with the run-ons that have been added to comparable changes in the past, but we think it's important, and in particular it gives us the opportunity to guarantee that the support that people will be offered will be provided for them before their benefit ends.
So, that's obviously quite a challenge to deliver that within that 13-week period, but just reflecting on the answer that you've given, and ministers often talk about the need to help disabled people into work. Appreciate why that is a priority. But can you understand why that might give some people the impression that the government doesn't think that PIP is not an incapacity benefit? There are actually many people who are in work receiving PIP to allow them to continue to work. Are you trying to incentivise work by restricting access to PIP?
No, as you say, PIP is a contribution to the costs imposed on people by their disability or health impairment. It's a contribution towards those costs, and the person receiving it can be in work or out of work. The benefit doesn't have anything to do with work. And about 1 in 6, I think, 17% of those who claim PIP are in work. We'd love it to be a lot more, and we're putting in place the employment support rising to an additional £1 billion a year by the end of the Parliament, and I'm hoping that'll give many more PIP claimants the opportunity to be in work, to fulfil their aspirations and have the same choices and chances that everybody else takes for granted. But it is the benefit is not work related. And it's important, I think, that people should be able to continue in work if they're on PIP. And indeed, those who are in work will be offered the personalised employment support that I've referred to, which will be offered to those who are out of work as well.
What assessment has the DWP made about the potential for that loss of benefit to affect people who are in work to stay in work? That's 17% that you're talking about, because a lot of people come to us as constituency MPs saying, I'm in work, but I'm only able to stay in work because of the PIP that I receive.
Yeah, no, I've had 1 or 2 of those conversations as well. And I think sometimes that's around the cost of travel to work. And of course, we've got the Access to Work programme, which does deliver help for that kind of cost. There are some long delays at the moment in Access to Work because of the very big increase in demand for it over the last year or 2. So we're consulting on how we should reform Access to Work, but that may be the answer for people to meet their travel costs if those are a result of ill health or disability. Some people make the point that they use their PIP for therapy of some kind, and that enables them to stay in work. And we have said, and I've mentioned, that we do want to make sure that people's health and care needs are met. And so we're talking to the Department of Health and Social Care about how that's going to be delivered. Then it may be, for example, there could be a referral in the health and care support conversation to Workwell, which is available in, I think, 15 of the 40-something integrated care board areas. And so the NHS, as we're fixing that, and that's an important part of the things that need to be done in parallel to all of this, the NHS may well be able to meet those needs in the future. So I think it does depend what PIP's being used for, and seeing whether we can meet that need in a different way. But I certainly don't want anyone who's at the moment in work having to give up their job because of these changes.
So, and I appreciate that you've said that you hope that people's health and care needs would be met, and everyone who loses PIP should have those health and care needs met by different parts of the system. But given that the government inherited an NHS that was on its knees, given the pressures on access to work, how is it that you think that all of those health and care needs would be met within a 13-week transitional period, given the pressures that are on the current system?
Well, I'm pleased to say we are fixing the NHS, as you know. And
it takes time to do that.
It does take time, and it's going to take time before these changes come in as well. So that's the point I was making earlier about the need to make progress on all of these tracks in parallel, including fixing the NHS, because it'll be November next year, so sort of getting on for 18 months, or 14 months, 16 months before the changes to PIP start to take effect. So we've got over a year there, and we do need to make progress in getting the NHS working properly. And as you know, we've made a very big financial commitment to the NHS this year, to make those changes. And actually, if you look at what's happening in the NHS, it's sort of there are some quite encouraging signs, I think, about progress on waiting lists. The 2 million appointments pledge has been exceeded, and there is good progress. We'll need to maintain it, and in all these areas we've got to keep making progress. But I think we are on track for being able to deliver what we need.
Yeah, so no pressure on Wes Streeting, but also I would make the point that is the NHS in England. So the same can't be said for the situation in Scotland, where the responsibility for the NHS lies with the government in Holyrood, where waiting lists are getting longer rather than shorter. Just moving on to my last question, just the concerns have been expressed about the impact on older PIP recipients, including those who are above the state pension age. The bill provides the Secretary of State the power to make different provision for persons of different ages. So will you use that provision to protect older PIP recipients, and if so, above what age?
Well, pensioners, people that is above state pension age, by and large will not be affected by these changes. And the reason for that is that they are on what is known as ongoing awards, with a light touch review. It happens once every 10 years or so. And the light touch review does not involve a reassessment. So for those who are over state pension age, the only circumstances in which things might change might be if people sort of reported a change, if their condition improved, they asked for a reassessment or something, then they would be assessed on the new basis with the 4-point threshold. But for people who are things just carrying on as normal, they won't be affected by the changes because they won't have a reassessment.
Thank you, Chair.
Thank you. John Mill.
Thank you, Chair. Good morning. You recently launched a PIP review. I wonder if you could give us a progress report update, and perhaps any ideas about the line of thought that you're minded to, ideas that you might follow.
Yes, we're looking at the moment at the terms of reference for the PIP review. The background to it is that it's a long time now since PIP was introduced. It was introduced, I think, in 2013, 12 years ago. I think the Chair and I will certainly remember that happening. And it's been looked at. Paul Gray carried out a couple of reviews, I think 2014, 2015. But what he was looking at was whether the criteria were being properly applied. We think now, 12 years on, it's time to have a a fuller look at this, not in order to make savings or anything, but just to make sure that the assessment is the right one for the current circumstances, because there's been a lot of changes in health incidents that we've been talking about in the last 12 years. And we think it's a good idea to take a look at the assessment from that perspective. But of course, the other thing that's happening is we are going to be using the assessment in a rather different way in the future, with this 4-point threshold being introduced. And so we want to take the opportunity to look at it from that perspective as well. So we're looking at what the terms of reference should be. I'm talking to lots of organisations and individuals, talked to a group of local authorities yesterday, and I'm hoping we'll be able to come forward with the terms of reference, I hope before the summer recess, and publish those so that everybody can see what we're envisaging.
Thank you. You've said that the incapacity benefit system focuses too much on what people can't do rather than what they can do, and that's one reason you're looking at removing the work capability assessment. However, the same could be said, or is true, of the PIP assessment process at the moment. So are you looking at how the PIP assessment could also be refocused on what people can do rather than what they can't?
Well, I think for the time being, the PIP assessment process will continue to look pretty much as it does now. But, I mean, there are people who are arguing, and you mentioned Ben Geiger earlier, there are people saying that that we should be looking, for example, not just at the functional assessment, but at environmental factors as well. Now, that would be a very big change, and it would take a long time and lots of thought and planning to start moving in that direction. But I think we ought to have that conversation within this review. So there may well be some changes that we want to make in the fairly short term, but I'd like us also to have conversations about how the assessment for this benefit should look longer term. And if there are some ideas behind your question that you think we should consider, then I'd be very interested to hear those.
Nothing specifically for today, but as part of the review, are you considering what changes that need to be made specifically to reflect the PIP assessment's future role? Because that can be the means by which eligibility for UC Health will be determined.
Yes, I mean, that's, as I said, the changed role for this assessment is certainly an important factor in the background to the review.
Thank you. Just following up on a question, an answer you gave in the House a couple of days ago to my question. Looking as far as PIP claimants specifically are concerned, so excluding the wider UC claimant base, would you agree that there will be far more net losers than net gainers by the changes you're making? And I mean the current claimants of PIP and also those who might have been able to claim but will not be able to claim in the future as a result of these changes. Would you agree there are far more net losers than gainers?
Well, you've made the point that if we exclude other people, I mean, so allow me to just make the point that, of course, overall there are more gainers than losers from the changes that are being made in the bill because of the increase in universal credit standard allowance received by a lot more people.
That's what you said,
so,
yes.
But that's sort of the wider picture. In terms of PIP, I've made the point that the current trajectory for spending on PIP is not sustainable. And so the changes we're making are intended to make it sustainable. The spending on PIP will continue to rise in real terms. The number of people receiving PIP we expect to continue to increase every year, but not at the unsustainable rate it's been increasing at over the last few years. Yes, there certainly will be fewer people receiving PIP in a few years' time than they would have been if no change had been made.
It's a correct statement. Far fewer. Far more net losers than net gainers.
Well, I'm not sure far few. I mean, we anticipate that by 2029-30, the estimate is, I think, 370,000 people who will be receiving PIP in November next year will not be receiving PIP by the end of the decade. So, yeah, that will be a number of people whose income is lower. Of course, I'd love it for many of those to be able to move into work, and we're going to be providing the employment support to make that ambition realistic for people in a way that it hasn't been in the past.
Thank you very much.
Thank you.
Thank you. Before we move on to Frank McNally, can I just ask the Minister, he probably recalls there was a bit of a controversy, I think it was about 2018, when it was announced that the previous PIP reviewers, both of them, so there's Paul Gray and then we can't remember the previous one, but they weren't provided with information about, for example, the IPRs that were undertaken on PIP who'd gone, people who had gone through PIP. Can you reassure the committee that in terms of the terms of reference, that data on deaths associated with assessments will be made available to whoever is undertaking the review?
Well, I'll be undertaking the review, so yeah, the information will be available to me. And actually, you know, we're being much, not least thanks to your work, Chair, we are being much more open about all of this now than was the case in the past. So information is being published in the annual review of the department, and you know, we want people to see what's going on. There isn't any benefit for the department in hiding these things. They were hidden too often in the past, and I think that's one reason why the department, the trust in the department deteriorated so badly, because people could see that things were being covered up and hidden, and it shouldn't have been happening, and I'm determined that it won't happen in the future.
Thank you. Frank McNally.
Thank you very much, Chair. Good morning.
Morning.
Minister, nice to see you. Thanks for joining us today. Can I just dig a little further into to John's point around the wider PIP review? So we know from the Green Paper section, Chapter 2, Section 2, which highlights the level of work that the department is going to undertake with regards to the wider PIP review, and I think that's to be welcomed, because I think we all recognise that needs to take place. In response to that previous question, you suggested that would have a short-term direction, but also the potential for a much longer-term direction. Would it be your expectation that any outcomes arising from those exercises will be implemented by the time that we come to the change in PIP eligibility in November 2026?
Well, the shorter term ones will be on a track for implementation around that time. Now, actually, practically, I don't think it would be possible to make those changes by November 2026, but we can make it shortly afterwards. And perhaps I'll ask Catherine to say a little bit more about that. But then there'll be the longer term changes could be much longer term, and depending on what the nature of those is, would determine how long it might take. But in terms of the time scale for sort of short-term changes, Catherine?
It depends upon a range of factors, including the department's ability to implement those changes, depending on the nature of the changes, whether we'd need to consult again, and factoring that in. So that's why it's difficult to give a precise time, and obviously we need to determine what we were looking at to give a clearer time frame.
Yeah, and I think that's what generates some of the concerns that members have been touching on, and I'll maybe come back to that in a couple of minutes' time. But on the wider assessment exercise, so to quote the Green Paper, it states, to make sure we get this right, which is the critical aspect of this, we have to bring together a range of experts, stakeholders and people with lived experience to consider how best to do this. So given the criticism that has been levelled from a number of key stakeholders, from a number of people with lived experience, from a number of experts, many of whom have presented to this committee, about some of the proposals that are contained within the Green Paper, is it surely probable, more than possible, that the points that will be highlighted to the department as part of that exercise will be contradictory to the new PIP eligibility and put us in a difficult place where we have an assessment that is perhaps suggesting that the eligibility criteria that we've put in place at this stage is not fit for purpose.
Well, I don't think so. As I say, I think the changes, if we do decide to make some sort of short-term changes, we'll be able to implement those, perhaps not quite by November next year, but not long afterwards. So that they'll be in place for the great bulk, at least, of the reassessments that occur after November next year. So that'll be post the review, or for that part of the review. So I think that should work okay, I think.
So you don't think, if you're engaging with stakeholders as part of that exercise, that wider exercise into PIP assessments, that they will not have criticisms of what the current eligibility that we're putting in place potentially from next week?
Well, I think we can make some short-term changes relatively quickly. If there was to be a more fundamental change to the nature of the PIP assessment, for example, in bringing in environmental factors rather than just functional factors, that would inevitably, I think everybody would recognise that would take quite a long time. You'd have to come up with ideas, you'd have to consult on them, you'd have to test them. I mean, that is quite a long-term exercise, and I think people would recognise that a big change of that kind would take some time in order to get right. I think stakeholders would recognise that.
Yeah, and I think that's a fair point, and ultimately I suppose that brings us to a core concern that we have perhaps put the cart before the horse, in the sense that we are undertaking are about to undertake what could be a comprehensive exercise into all aspects of PIP, but we're going to be doing so after making changes to these to the eligibility criteria for that. Do you understand and do you have reflections on that argument that the government has perhaps put the cart before the horse on this?
No, I understand the argument. I don't agree with it. I think the need for the funding for PIP to be on a sustainable basis is clear, and we've talked about that, and urgent, and the government has needed to work on that. But, it's a benefit that's been in place for 12 years. I think it is appropriate to think about whether in the future it should look rather different. But I don't agree that we shouldn't do anything until we've sorted that out, because, it could be some years, I think. If there was a view taken that we ought to adopt a different kind of assessment, a different approach to assessing eligibility for this benefit, that inevitably will take some time. But I don't agree that the government ought not to do things in the meantime, because the sustainability points does need to be addressed.
Okay, thank you.
Thank you.
Thank you. John Milne again.
Thank you. The bill just published provides for rebalancing of UC rates that you set out in the Green Paper, and it includes a significant reduction for new claimants after 2026. The justification is that it will incentivise people to find work, but we've been told it may have the opposite effect, and that's happened in the past when similar cuts to welfare have been introduced. So why do you think it's going to be different this time round after previous experiences?
Well, partly this goes back to the discussion we were having earlier, that at the moment there is a very big incentive for people claiming universal credit to seek to be classified as LCWRA. I mean, it's appalling phraseology, but because, if they are classified as LCWRA, then they get a premium which is worth more than the universal credit standard allowance, and that is unavoidably a massive magnet for people. And I see this in the correspondence that comes across my desk, and one letter from somebody who'd written to their MP who made the point that I'm classified as LCW, which means they get the ordinary universal credit rate. And the letter said, if only you classified me as LCWRA, then I'd be paid £400 per month more, and I would be comfortable. And I think this is a really serious flaw in the current system, that it presents this sort of LCWRA status as a sort of something to aim for. If only I could get to that, I would be comfortable. When the system should not be doing that to people. That is a very bad feature of the current system. What the system should be doing is encouraging people to aspire to work and providing the support to make work possible and feasible. And so, yeah, we are wanting to substantially reduce that incentive, and in part it's by raising the level of the Universal Credit Standard Allowance, which, as we were saying earlier, has been driven down to this much too low level up till now.
Is there not a case for arguing that if you press down on one benefit, it simply in the end comes up in another benefit, and that's why the overall level of benefits has remained quite constant over a long period of time, as Debbie said at the start, and that this is likely to happen again, and that people were driven into PIP because they lost access, or their needs were not being met by another benefit. So what we should be doing really is concentrating on needs first, Treasury second. But I feel like we're doing Treasury first, needs after.
Well, I mean, you're certainly right. There are examples where cuts in one area have led to increases in another. And I mean, the classic example of that is the rate in universal credit for LCW, limited capability for work. Because when ESA was introduced, and the work capability assessment was introduced in 2008, and I ought to come clean with the committee and say, actually, I was the minister responsible at the time, that there were three levels that the work capability assessment evaluated you for. If you were fit for work, then you got the ordinary benefit rate. If you were limited capability for work, you got a bit more. And if you were LCWRA, that is limited capability for work, but also not able to undertake work-related activity, you got a higher amount still. There were three levels. And in, I think it was 2015, the then government scrapped that middle rate, the LCW rate, and people in the LCW category since then have just got the ordinary level of universal credit. But the Office for Budget Responsibility has made the point, I think in its 2024 welfare review, that what actually happened was not that people in the LCW group had a lower income, but very large numbers of them went into the LCWRA group, and once they were there, yes, they did get some extra money, but they got no help at all. There was no support for them to get into work. The system abandoned them. And so that, I think, is a very clear kind of textbook example of exactly the problem that you've described. But we're aware of that, and we've designed our changes in the light of that problem. We have seen this big increase, particularly over the last 6 years, in spending on health and disability benefits. We don't think that is inevitable. And
needs first, not Treasury first, because it feels like you're still saying Treasury first.
No, I think it is about needs first. I think we're saying we need to focus on supporting people to move into work, to fulfill their ambitions and aspirations, to have the same choices and chances that everyone else takes for granted, and not hear from the system what they hear at the moment, which is you are not capable of working. That's what the system is telling them, and it's just not true.
Okay, and then one last question. We've also been told that the bigger problem is not so much the disparity between the standard allowance and UC Health as the inadequacy of the standard allowance, and we've talked a bit about that already. The bill requires the Secretary of State to increase the standard allowance by, quote, at least the amounts set out in it. So, and in the Green Paper, you talked of starting to improve the basic adequacy. So does that suggest that you are actually looking at increases beyond the ones that have already been set out so far?
Well, let's see how we get on. We have announced those increases, and they're in the bill being debated next week. Beyond that, I'm not in a position to say. But of course, there are certainly aspirations around. I think everybody will have heard of the essentials guarantee idea. There is a case to be made, but let's see how we get on.
Thank you. Amanda Hack.
Thank you. Thank you for coming to speak to us this morning, Sir Stephen. I think I'm going to move over to the individuals who are on the severe condition claimant criteria. But first of all, one of the things I just wanted to raise is the huge amount of uncertainty that disabled people are feeling at the moment, and that actually causes a huge amount of stress. In light of the work that we've been doing on the safeguarding vulnerable claimants, how have you balanced that uncertainty and the risk on those individuals are actually very poorly? How are you managing that in the department at the moment?
Well, I do recognise that that is a very significant issue, and that there is a good deal of anxiety around. Of course, change does sometimes need to be made, and we've got to do it in a way that is as helpful and supportive as possible. So the changes, particularly to PIP, as I've said, are not going to start until November next year, and not until each individual's award review after November next year. So it's still some time away. But I accept it is. There is always some uncertainty because people do get reassessed for PIP from time to time. The basis next time will be a bit different, but reassessment is always a feature of the system, and therefore uncertainty. And I don't think there's a way of avoiding that. We are taking very, very seriously the need for the department to do better on safeguarding. And as I've said, I very much welcome the committee's work on this. We're consulting in the Green Paper. The consultation is open until Monday, and we're keen to get more responses. We've had, I think, about 40,000 so far, but we're eager to have as many as possible, to hear from people about how they think we should do that part of our job. And once we've been able to go through those consultation responses, we'll come forward with our proposals.
Okay, thank you. And I wanted to establish that point before I went on to those individuals with severe condition criteria claimants. So they'll continue to receive UC health rate beyond 2026 and never have to undergo a reassessment. The decision, though, about whether somebody qualifies will depend on the result of a work capability assessment, but the work capability assessments to be abolished. How will that all work?
Well, the work capability assessment will be in use for some time yet, I think another 3 years or so. But you're right then, we will, and the severe conditions criteria are whether or not somebody fulfills those criteria comes out of the current assessment. But once the WCA has gone, we'll obviously need another way of establishing that. And that does require some serious work and planning. And so all of this will be set out, our detailed proposals on this, in the white paper that we are intending to publish in the autumn. And I'm hoping we'll be able to publish it at the time of the autumn budget. And there are quite a lot of issues. The results of the consultation closing on Monday, our assessment and a response to that consultation, this particular point, other points as well that we'll need to set out in our in that white paper in the autumn, and there'll then need to be further legislation to follow.
Okay, lovely, that's helpful because, obviously when the Secretary of State in a recent letter referring to the protections of those who would never be able to work, she said she'd provide those details, so I'm assuming that's where those details will come.
Yeah. That is a very important part of the system that we'll need for the future.
Yeah, lovely. So how will you protect those who will never be able to work again in the future? What are your thoughts around that?
Well, what we've said is that they will be able to receive the higher frozen rate of the universal credit health element. And in addition, we will assure them that they will not need to go through universal credit reassessments in the future. Those are the two key things that we're envisaging.
So you said they're going to receive the higher rate, which will be frozen. So
Yes,
how does that protect somebody who is on a lifelong support because they're unable to work? How does that protect them if their financial position is frozen in a point where costs are going up?
So somebody who's receiving the universal credit health premium their income will typically, there might be other things as well, but it'll typically consist of the universal credit standard allowance and the universal credit health premium. The latter will be frozen in cash terms. The Universal Credit Standard Allowance is being increased by more than inflation. Now, if you add those two things up, then it isn't quite the whole income going up in line with inflation. And actually, it depends a little bit what inflation proves to be over the next couple of years. But so I think it's sort of broadly protected, and it's certainly protected compared with other incomes for people who are not in this category, for example. But I think by the end of the decade, the last figure I saw suggested that people might be a couple of percentage points, their income might be a couple of percentage points lower than it would have been if the system had just carried on as it is at the moment. But that does depend on exactly what happens to inflation.
So in broad terms, overall, their income will fall below inflation because there is a frozen element and an increasing element. They're actually, over time, their incomes will fall in real terms.
Depending on exactly what inflation turns out to be, it may be that the total income doesn't quite keep track with inflation.
Thank you, Chair.
Thank you. I just want to ask about the additional premium that's also in the bill that we're voting on Tuesday. So who will this be for? How much will it be? And when will it be introduced? And how do people get it?
Well, this is the Universal Credit Health Premium that we've just been talking about.
The additional premium?
No, it's the Universal Credit Health Premium, which will be payable to existing people who are in the LCWRA group currently, and will keep it over the coming years, and also others, and we've talked about people with meeting the severe conditions criteria.
When will they get that, Minister? When will they get that?
Well, those who are receiving LCWRA at the moment, it'll carry on, so they'll just continue with the Universal Credit Health Premium. And then others who are newly eligible will receive it as they apply for it and are assessed.
I asked specifically a question I didn't get a chance to ask before. What are the intentions to do as we, I think, committed to during the general election to co-produce policy with disabled people and their organisations? How are we going to make sure that's embedded in terms of the development of policy?
Well, there's a lot that needs to be done arising from the changes that we're making. Just as an example, we will be setting up a disability advisory panel to work with us on the proposals in the Get Britain Working white paper around employment support, and also collaboration committees which are sort of shorter term, more focused groups looking at exactly how the employment support that we're committing to can best be delivered. And I think that's going to be a very important part of co-production of policy, because we made this big commitment rising to £1 billion a year on employment support by the end of the Parliament. It's absolutely vital that we use that funding in the best possible way to support disabled people, and we need to work with disabled people on how we're going to do it. So I met recently with the Disability Charities Consortium, Scope, MenCap, Sense and the others, and they're very excited, I think, about the opportunities that this £1 billion a year commitment opens up for the people they are supporting, and will be working closely with them and with people with lived experience of disability as well to design the support that will be in place.
Thank you. Annie Kruger.
Thank you, Chair. Stephen, you said earlier that you're going to press ahead with the bill next week. At the moment, you don't have a majority to get it through the House of Commons unless the Conservatives support the bill. Would you like us to, and will you press ahead if you can only do it with Conservative support?
I'd be delighted to have support from across the entire House for the excellent proposals that we're bringing forward, and I'm looking forward to the debate on Tuesday.
Good. Okay. Well, to get our support, we'd need to have confidence that we were going to see genuine reductions long term in the overall spending on welfare, which we don't believe will happen under the current proposals on their own, and to see genuine support on the labour market side. At the moment, we're seeing jobs being destroyed through actions of the government to pass its unemployment bill, leaving aside the national insurance rises, which job centre workers that I've spoken to say is devastating, the work they're trying to do to support people into employment. So on their own, it doesn't feel to me that these this bill, which is not really a reform bill, it's just a cuts bill, it's not even going to achieve significant welfare savings. Can I ask you specifically, do you accept, and I'm basing this on evidence from Citizens Advice and the Resolution Foundation and others, that, I completely agree, by the way, with what you said earlier, which is that for many younger people, particularly those with mental health conditions, the best thing for them would be to be supported into employment, and I agree with you on that ambition. Nevertheless, the proposals in the bill will fall disproportionately, the cuts, the benefit reductions will fall disproportionately on older people and those with physical health conditions rather than on younger people with mental health conditions who will continue to be parked on benefits. Do you accept that that's the likely effect of the reforms, that it would be older people who would be more likely to lose their PIP?
No, I haven't seen an assessment along those lines. We will be offering employment support to everybody who loses their PIP, whatever their age, and we would like to see many more people in work. There are 2.8 million people at the moment out of work on health and disability grounds, economically inactive. 200,000 of them say they'd like to be in a job now and think they could be in a job if only they had the support to get into work. And we are determined to provide that support, and that will extend across the entire age range. We certainly want to support young people for the reasons that we've talked about and that you've recognised, but we want to support older people as well.
Well, I mean, the Resolution Foundation says that the likely impact of the PIP changes is that older claimants are more likely to be impacted than younger claimants, and they're also less amenable to the incentives, as it were, so it's harder for them to respond to a reduction in benefit income by seeking work or more work, whereas younger people are more likely, naturally enough, to respond to those incentives. So I am concerned that you're targeting older people who are less likely to respond in the way that we all want.
We'll be offering support to older people as well as younger.
Although that support isn't going to come in for another couple of years. No,
the support is being rolled out now. So the Connect to Work programme is being rolled out across the entire country, the whole of England and Wales, by the end of this year. And that next year is funded to support 100,000 people. So no, the support is coming into place now. It's building
and it's
up.
Starting. Starting slowly. It's 100,000 people when we're talking about
a year by the end of the Parliament. But we're on track for.
Okay, but we're talking about millions of people currently parked on benefits, and you're only proposing to support 100,000, of whom not all would necessarily succeed in getting into employment.
No, that's not the case. I mean, it's 100,000 on Connect to Work, but there are lots of other things that are going on, inactivity trailblazers, and this growing programme that I've referred to, building up to an additional £1 billion a year by the end of the Parliament. So there's going to be a huge amount going on. I mean, the scale of this is unprecedented. This has never been done on this scale before. I remember the New Deal for disabled people, which was quite experimental when it started in 1998, but it steadily reduced the disability employment gap between 1998 and 2010, and then in 2010 it was all scrapped, and the disability employment gap has hardly shrunk at all since then. So we want to get back onto that trajectory of providing proper employment support to the very large number of people who at the moment are out of work on health and disability grounds. And needlessly, they could be in work.
Indeed.
We've got to give them the help to make sure they can.
Indeed. Okay. Well, let me just turn to UC Health then, because as we've said, that is now essentially being merged with the PIP regime, and it's not clear to what extent this is now a disability benefit rather than an incapacity one. But we'll look forward to seeing the product of the assessment review. But the proposal is to cut in half the UC Health premium for new claimants. That still leaves a £50 a week roughly uplift in people's income if they manage to get onto the LCWRA cohort, which is less than £100 a week, but it's still 50% more than they'd be getting otherwise. You're suggesting that the increase in the standard allowance will somehow reduce demand for the UC Health component. I mean, that's a £5 a week uplift, whereas there's a £50 a week prize if you do get onto LCWRA. So do you really think that we're going to see a significant reduction in UC Health claims as a result of the reduction in the entitlement? I mean, especially as you've just acknowledged that overall it's unlikely that this will outstrip inflation anyway, so people are still going to be incentivised to seek the UC Health component. And so even if the spending reduces, the numbers of people in receipt of that surely will continue to rise unsustainably.
Well, first of all, and Sean may be able to help me, the increase in the Universal Credit Standard Allowance by the end of the period we're talking about is somewhat higher, I think, than the figure that you...
Real terms, it'll be £5 a week, won't it?
It's 265 a year, so yeah, that'll be about £5.
Okay, right.
In real terms.
Yeah. But I mean, the key thing is, we're reducing the incentive, but we're also providing support. And that's the key part of the jigsaw which has been absent in the past. There must be proper employment support. So it isn't just a question of reducing the level of the premium, but providing the support that people need.
Still no conditionality to seek that support or to take it.
Well, conditionality is an interesting topic, and I mean, if we're moving on to that, I'd be very interested to talk about it. I mean, I think the evidence is pretty clear that the best kind of employment support for people who have to work on health and disability grounds is voluntary support, where people have chosen to seek that support. But we do need to think more, I think, about conditionality in this area. And certainly it's my view that it's perfectly reasonable for the department to expect to at least have a conversation with people about their work aspirations and how they're setting about getting the support that they need. But the key target for us, I think, at this stage is those 200,000 people who want to be in a job today, who think they could be in a job today, to make sure they've got the support to.
I suggest we try and create jobs and well-paid jobs for them.
As we are doing.
And as I know you want to do, but you're going about it in a very perverse manner, in my view.
Let me just comment. I mean, employment is up, inactivity is down since the election. We want to keep on that trajectory. There's a long way to go, but we're on the right track.
Unemployment's up as well. It's a perverse set of contradictory stats that we can trade with each other. Let me just quickly finish, Chair, with the question.
I don't think they are contradictory. I think what's happening is that the inactive bit of the system, which is the reason that 2.8 million people at the moment are out of work on health and disability grounds, people are moving. People are moving into employment. People are moving into the active part of the system, and therefore being counted as unemployed. And there they are getting the help that they should have been getting, or starting to get the help they should have been getting years ago.
All right. Let me just ask you again, following up my question to you in the Chamber yesterday about Motability. I understand you're not looking at the scheme. Why is that? There's been such an increase in expenditure on that scheme now. A lot of people getting vehicles. Only 5% of vehicles are adapted for physical disabilities. So a lot of people are getting vehicles who don't have physical need for transport. It's £3 billion a year, way larger than it used to be. Do you not think that this is an area that you should be looking at?
Well, I think the Motability scheme, the mobility component of PIP, has an important job to do. And we were talking earlier about people being able to get to work, and the mobility component is very important for many people with a health issue, disability, to enable them to stay in work. So,
you think the scheme's fine at the moment?
I have had concerns raised with me about some aspects of this, and I've no doubt at some point we will want to have a look at it. But it's not part of the proposals that we're bringing forward at the moment.
Thank you, Chair.
Thank you. Frank McNally.
Thank you very much, Chair. Minister, there's a lot in the Green Paper, as you've just touched on with Danny and have throughout the day, to be welcomed, especially for young people. I think I've been absolutely clear on that. However, there has been a concern highlighted to us in evidence from stakeholders around the restriction of UC Health to those under the age of 22. So we had evidence from Dr. Lucy Fowkes, who is a psychologist from the University of Oxford, and she highlighted that the move to delay access made no sense developmentally and would cut off support at a critical time in a young person's life. Do you have a view on that? Can you maybe talk us through some of the rationale behind it?
Yeah, I'll be glad to. So, our concern is, at the moment, too many young people are being categorised as unable to work right at the start of their working lives, and left with no engagement and no support. And that means that they face the prospect of being trapped in long-term economic inactivity before their career has even begun. So there are at the moment 150,000 16 to 24-year-olds in this LCWRA group who are not getting any support with work at all. Now, we've announced our youth guarantee, that we want every young person to be learning or earning, including young people in a universal credit health group. And we want to be talking to them, we want to discuss their goals and ambitions with them, how we can help them to access the right support. Those conversations are certainly going to need to be tailored to the individual's circumstances, including their health. And I'm sure there will be some of those 150,000 people who we won't be able to have a conversation with. But to say that the 150,000, we're just going to leave them where they are, I don't think that makes sense. Now, the reason for consulting on this proposal about not paying that group the universal credit health premium, and we are consulting on it. We haven't made a final decision on it. The consultation, as I've said, is carrying on until Monday, and then once we've seen the responses, we will take a view. But the reason for proposing it is to make sure that for this group in particular, as they are moving from education into full-time work, and that transition is so important for their future prospects, we want to make sure that there isn't an unhelpful disincentive to work, and also that there is some additional funding available, because we'd use the proceeds of this to improve the support focused very specifically on that crucial group of young people. So that's the argument, and we're consulting on it, and we'll see what everybody says in response.
Yep. So I suppose a critical aspect of this, and it was touched on earlier on, is the mental health crisis that we have just now. There is a mental health crisis impacting young people. They're not immune to that. If I look in a Scottish context, the British Psychological Society recently highlighted the Scottish Government's cuts to mental health services as creating a sort of perfect storm. We have a 3-year backlog for some areas of mental health support. There are equal challenges south of the border, but you are right that the Health Secretary has taken action with regards to that we are not seeing in Scotland. So you are having some of that cross-border differentiation. So I do want to ask you around, just briefly, on that relationship between the devolved context in Scotland and UC Health. So we're moving to adult disability payment in Scotland, and we have UC Health. How do you see that relationship forming? Because you could have some challenges here, I expect, and how do you plan to navigate that in the interests of people who are going to potentially qualify for adult disability payment, but would potentially not qualify for PIP?
Just starting on finishing off the under 22s point, I agree with you about the importance of improving mental health support, and I think that the Scottish Government should be following the lead that Wes and his colleagues are taking in England. And of course, we know the best thing for somebody's mental health, particularly at that crucial point in their development, is to be in good work. We're wanting to, pull out all the stops to make that possible for people. There are some quite significant issues around devolution and around the universal credit health premium, as you say. And the key one, clearly, and you're sort of hinting at this, I think, is that in England and Wales, the gateway to the universal credit health premium will be through personal independence payment, and PIP is being replaced in Scotland by the adult disability payment. So the question then is, what will the gateway to the universal credit health premium be in Scotland? Now, to some extent, this depends on decisions in Scotland about whether the eligibility for ADP will be changed along the lines that we're changing eligibility for PIP. That's a decision for the Scottish Government, and we'll see what's decided. If the decision is to follow the direction, and up till now, ADP has been broadly in line with PIP. So if this was in place today, I'd be perfectly happy for ADP to be the gateway to the universal credit health premium. If in the future, however, there are large numbers of people who were eligible for ADP in Scotland who would not be eligible for PIP in England, then that does present a difficulty for us. So that's something that we will need to work out. We are talking to the Scottish Government, and I am anticipating that we'll be able to set out our solution in the white paper in the autumn, depending on the decisions the Scottish Government makes.
Thank you. Sure.
Very much. David Pinter-Duchinsky.
Thank you so much, Chair and Minister. Thank you so much for taking the time to join us. As you'll be aware, under the current incapacity benefits regime, there are protections in regulations for certain groups of people who qualify automatically for LCWRA, meaning that they qualify for health, and so they're treated automatically as though they should go on to LCWRA, so qualify automatically for the health component of UC. Will the groups who benefit from those protections continue to do so in the reform system?
Well, yes, there are people who at the moment are LCWRA due to non-functional special circumstances, which I think is probably what you're referring to. People with cancer, for example, going through cancer treatment, people with a high-risk pregnancy, and also people classified as substantial risk at the moment. And we are recognising that we do need to work out how we're going to protect those people in the future, and the details of what we're proposing will be in the white paper.
Fantastic, thank you. Obviously, as part of this conversation, the previous government was on the verge of significantly amending the substantial risk regulations to reduce the number of people receiving UC health on these grounds. Do you plan to recreate those regulations in the reform system?
No, we don't. I mean, it was sort of a slightly odd plan that the previous government had, which was to abolish WCA, but to make big changes to it for the kind of last couple of years of its existence. And we've made clear we're not going to make those changes to the WCA. We're going to abolish the WCA. We're not going to change that. And there was a great deal of concern about the proposals to change, to tighten up the substantial risk criterion through those changes. So, we're not going ahead with those changes at all.
Thank you so much, Minister. Thank you, Chair.
Thank you. Joanna Baxter.
Thank you. When does the government plan to legislate for the right to try?
We will be bringing forward regulations, and those regulations I shall be placing in the library of the House by Monday. So they will be public ahead of the second reading of the bill due to take place on Tuesday.
Don't give us much time to read them.
Well, I mean, it's the start of a process. It's and I've no doubt that once people have seen them, people will have comments on them, and no doubt between then and the regulations taking effect, there'll be some changes. But so we're doing it sort of in parallel with the bill.
Many people fear losing their benefit if they try to work. So the Green Paper says this is mostly because the rules are complex and people don't understand them. But recent government research does identify a lack of understanding amongst claimants, but also says that the main problem is a lack of trust in the DWP, which we've touched on previously. So do you agree that the main problem is not the lack of understanding in the system, but a lack of trust? And if so, how is the department going to rebuild trust, especially in light of the proposed cuts to PIP and UC Health?
Well, there are rules at the moment, and they've been in place for some time, to encourage working age people in receipt of health and disability benefits to try work. I don't think those rules are very well known. But it may be, as you say, that even if they were, people wouldn't really believe it, and so it wouldn't make very much difference. There is a lot of worry, as the department's research indicates, that engaging with employment support at all could lead to having to look for unsuitable work. It could well trigger a reassessment, a WCA or a PIP award review. And that, you know, if they then did go into a job and it didn't work out, then they'd struggle to get back on their benefits. All of those worries, I think, are quite big in people's minds. So the fact that this will be on the statute book, hopefully, will reassure people that this is for real, that they will be able to try work and not risk losing their benefits if the job doesn't work out. I think having actual legislation should help. There is. I'm hoping we can build up trust more generally, but we are where we are.
Thank you. Back to David Pinto-Jansky.
Thank you, Chair. And Minister, one other area that will, of course, be very relevant in the conversation about pathways to work and the broader Green Paper is the issue of conditionality and the conditionality regimes that will be developing. You're consulting on the conditionality regimes to be applied to UC recipients in future. Obviously, there'll be some quite significant change, and this may cause anxiety among some people, as technically the majority of those currently in the LCWRA will potentially in future be subject to conditionality. Can you give us any more information about the future conditionality regime in addition to what's in the Green Paper?
Well, you're right. The work capability assessment at the moment is used to determine the conditionality applied to a particular individual, and somebody classed as unable to work, as LCWRA, they get no support or engagement at all. They're abandoned by the system. What we want instead is to be able to guarantee personalised employment support to anybody on out-of-work benefits, on ill health or disability grounds who wants to work. And so that does require, I think you're absolutely right, a new approach to conditionality. It needs some careful consideration. We want the views of others to help us work this out. And we recognise that health impairments, disabilities can be complex, things can fluctuate, and the support that an individual needs may well change over time. And we need to acknowledge and recognise that. So conditionality does need to be tailored to an individual's needs and capabilities. So we are consulting on how to determine who is subject to a requirement only to participate in conversations, which would be kind of one end of this, or in further work preparation activity, which would be another level, or then there is the kind of stronger requirements in the current work search regime. All of this needs to be thought about very carefully, and we are expecting to bring forward our proposals once we've got all the consultation responses assessed in the autumn.
Thank you. Can I just quickly pick up on that point you just made, and it harks back a bit to the conversation had a few minutes ago about the former structure of UC, where there was an LCWRA and an LCW, and similarly the ESA famously had 3 categories. And it sounds again like you're envisaging a spectrum, but there'll be some who just have a subject to pretty much full work-based conditionality. Some will be subject to conversations, but not much more. But it does sound like again we are almost re-evolving. And by the way, I think it's the right decision, re-evolving that middle category. But could you say more about what that middle category would entail? In ESA, it wasn't full work conditionality, but it was some form of near work or near, something that moved you towards the labour market. What do you envisage that looking like?
I think the biggest changes would be for those who are in currently in the LCWRA group who get absolutely nothing at all at the moment, because our view is that it's reasonable to expect the great majority of people, at least, to talk to us about what their work ambitions are and about the support that we can provide to enable them to fulfil those ambitions. There will be some people who that wouldn't be appropriate for at all, who should be exempt from the requirement to have conversations. But there's a large number of people who are not getting anything at all at the moment, and we want to have conversations with them. And the evidence is increasingly clear that simply having a conversation with people about these matters, helping them to think through what the possibilities are, has a very positive and significant impact in terms of enabling people to move into work, including people, the system has told for years, you can't work.
Oh, absolutely. And I think, and I suppose some of what I'm getting at, and it's probably me not being so clear, is between pretty much substantive labour market engagement and those initial conversations, and the evidence is really clear. Even having a chat, raises employment rates by 3%.
Yeah.
There's probably, it sounds like you're envisaging something halfway between those two. Is there something else, going further than simply engagement, but not yet at full work conditionality that you're envisaging for people?
Well, I think, on the whole, I think the right approach here is a voluntary approach, to offer people the support that's available, and it's then for them to decide whether to take it up. These are kind of an early part of the conversation here, and I say we'll have much more after when we come forward with our white paper. But I think the principle that the support that we're offering should be taken up voluntarily by people is the right one. But we do want to make sure at least we're talking to them about what the opportunities are.
Brilliant. That's very helpful. One other thing you mentioned was around tailoring and tailoring of the system. Who do you anticipate doing that? So will it be driven by work coaches? Will it be driven by disability in employment advisors? I think we've seen in the past that who tailors what hugely drives the shape of it and what the outcomes are. So how do you see that working?
Well, we are wanting to have in place a network of work coaches who specifically been trained up to do this work amongst people out of work on health and disability grounds. The dedicated pathways to work advisors, and I think we've got 1,000 of those now in place, equivalent to 2 in every job centre. We've got the Academy for Work Coaches that'll be training people up specifically for this work. It's important work, and we recognise that those who are doing it do need to have the training and the support to enable them to do a good job. But essentially it's going to be led by, at least initially, by those advisors in job centres.
Okay, thank you. And one final question from me, because again, we've talked about these three categories, and quite rightly, your focus is on LCWRA, and that's also, as we've heard previously, where increasingly the kind of disincentives and kind of issues are. But the LCW category does still persist, even though from a benefit standpoint, it's been equalised with the standard rate. And there are people in LCW who aren't yet focused, aren't yet subject to full work community additionality in all cases. Do I read correctly that the view is that they will become fully subject to work community additionality under the Green Paper?
I think I'm going to sort of duck the question and say I'm glad to come back in the autumn once we've thought all this through properly and talk more about how we see it all panning out.
Thank you so much. Thank you, Chair.
Thank you. Peter Bedford.
Thank you, Chair. I'm just conscious of time, and there's one more member wanted to get in. Two quick questions. You mentioned about conditionality. Do you envisage the uptake of employment support ever being a condition of a disabled claimant's benefit? Is the first question. The second question, which following on from Danny's point earlier about the support that you're going to be providing, isn't actually going to be fully rolled out until the end of the Parliament. There's a lag between that support and the changes you're making. Do you accept that that's going to leave a gap?
On the first point, I think the evidence is clear that a voluntary approach here is the most effective, that people are best supported when they have chosen for themselves to take up employment support. The motivation is there, they've been involved in deciding what to do, and that works more effectively. And now, let's see how things pan out. But I suppose our focus to begin with is those 200,000 people who want to be in a job now, and think they could be if they had the support that they needed. Let's make sure we get them the support. But I think that primarily we're talking about a voluntary approach. It's true that the support that we are providing will be building up over the next few years, but as I was saying earlier, Connect to Work, entirely new, that's going to be available across the whole of England and Wales by the end of this calendar year. So we're not hanging around on this. The number of people who are in the frame for support will build up over the next few years. With the PIP changes take effect and so on, and the support we're providing will build up as well. But I think those two things will happen in sync, and so the support that's needed will be in place when it's needed.
Thank you. So sorry, Amanda. I was looking at Joe.
No, not at all. I suppose I really sort of wanted to press the point about the time lag, because a lot of the changes that we want to put forward is encouraging people to get into work, but the key programme don't come on stream until the back end of the Parliament, so that doesn't really feel in sync. I suppose the other thing I just wanted to reflect on can I
just have a go? That's not how I see it. As I say, the key programme is going in place this year. The changes we're talking about in the benefit system start from next year, but the number of people affected by them will grow over time. So I think the support that we're providing will be in place in line with the need for it.
Okay, I'm not quite sure, but we'll leave that one. I suppose the very one thing that I get worried about is actually the point at which people fall out of work. So how will you be supporting those people who have got disabilities and they see the loss of their income actually means that they can't work anymore? How are we going to do rapid support for those individuals? How are you going to prevent them from not feeling that they can work long term?
Well, I think there's a number of points here. I talked about the employment support that we'll guarantee to people during the 13-week run-on period after a decision about benefit is made, and I'm confident we'll be able to deliver that by the time all of this starts in November next year. But I think there's more than that we need. And so Charlie Mayfield's Keep Britain Working review, I think, is really important here, because we are going to need employers to be more supportive of people who've got a disability, got a health problem. I think at the moment there are quite a lot of people who run into a health problem in the course of their work and feel they've got no alternative but to leave work, when actually with quite modest changes they could continue. And, you know, there are some really good examples that I've come across of employers who are providing that sort of help, but a lot aren't. And so I think Charlie Mayfield's work is going to be important here, and I hope helping us to sort of change the culture amongst employers to make it much more likely that people can get perhaps a bit of flexibility or whatever it is that's needed to enable them to stay in work or return to work.
Thank you. Thank you, Chair.
Thank you so much, Minister, and your officials as well. Thank you for coming to see us and providing evidence to this last session of the Pathways to Work inquiry.